by now you know what is simulation thinking. So today we are straight away going into a racing scenario, which always I tell you, because I'm crazy about racing, and I'm sure you all are crazy about at least driving faster. Just when you're in a racing game or in a game, any game, I've always told you, in your brain, simulations are always going on. Brain always tries to simulate things. And if you know to use those simulations for good, that is when you say it's simulation thinking. And your brain is trained to do it. So just imagine you are in a racing game and there's 3-4 opponents or AI cars which is racing against you. And there's a particular turn. Before that turn, you are not really able to close the gaps. And the car from behind, he tries to overtake, and you have no other choice and just decelerate for the next turn. And he is not really scared, he just shoots and he just overtakes, and you lose your position. And within seconds, or maybe like around 8-9 seconds, there's another turn which is coming up where you have an option to again go and overtake. But when you're trying to overtake, the only gap which you got to overtake is through the left, and you're really comfortable to overtake to the right. If you are a proper racing driver, you are trained, your brain is trained to just overtake to the left or the right. It is unconventional for your brain, but you do it. Now let's straight away switch to something else in real life, okay? There's something called innovation. What is innovation? Many people define innovation in different ways. Most of the people nowadays say innovation is all about problem solving. Problem solving is completely different. But yeah, if there's a problem and if you try to solve that problem in a unconventional or a unique way, sometimes it will be a new device, new technology, maybe a new system. It's all innovation. So it's kind of problem solving, but it's not really problem solving. If your brain has to think innovative, you should always think out of the box. Now let's come back to the racing scenario. If you have an innovative brain, or there's an innovation part in your brain, there's a prefrontal cortex of your brain. That is what really decides the logics. So if your brain has this innovation skills, you straight away say, okay, there's a left, overtake it. So you have to train your brain to go through the unconventional ways of overtaking, to train yourself to be more innovative. Now let's come to a nursing simulation, okay? Because I don't want to waste your time, and we have to go through more simulations and more thinking. You are getting a job in a hospital. So most of the hospitals are running for the public, and many of the hospitals, they run for profit. Whatever it is, it should be budget conscious. Just because you get a job as a nurse doesn't mean that you are just serving the people. There is money involved. So when you are in the nursing job, the first few days, your supervisor will tell you, you have to be careful about your budget. This is the budget which is allocated. So this is the number of syringes or the vaccines or medicines or the inhalers which you can take from the storeroom. And you should be cautious about the inventory and also conscious about the budget. So if there's a simulation, in the simulation, already there's a crisis, okay? So you have 10 or 15 breathing problem patients. They are going through nebulisation, and all of a sudden there's a power failure. And this power failure, you can't really stop it. And when there's a power failure, you ask your supervisor, what is the situation? And she says, okay, see the power will come back only after 3 hours, you will have to manage it. So all the nebulization units are working on the electricity, and there is a power which can back up for another 2 hours. And that can manage only for maybe around 3 or 4 patients. So there's a lot of options for you. You can call the storeroom and ask about the inhaler options which is available there. Go for the dosage. Is it allowed to give to these patients who are going through nebulization? And you can pressurize, or you can force, or you can put a pressure on your supervisor saying, no, the patient is critical, so he needs the nebulization. So put them in the same priority of the people who are in the ICU, so they get the nebulization. And this is one scenario. Imagine if there's a simulation, so you go through the training and you know to tackle this situation beforehand. The same nurse, let's come to another situation where the nurse needs around 100 syringes for her duty for the day, and there's only 10 in the nursing station. So she calls the storeroom and asks. Storeroom says, okay, there's 2 sets of syringes. One syringe is like the premium, which is normally given for the insulin patients, and the other one is given for the normal thing. But there is a lot of overstock of the premium ones. The budget ones are very less. You know, the storeroom manager might put pressure, say, okay, we can go with the premium ones. Okay. Sometimes he will say, no, you can't take the premium ones. It's you who should decide. So, there's a problem. Like, only the nurse knows. I know only a bit, but in my understanding, the premium ones is for insulin. So what if there is some patients who come, maybe next week or 2 weeks after, maybe 10 patients or 20 patients turn up for the insulin, and these premium ones are not there. And the normal syringes can't be used for that insulin thing. So there will be a crisis at that time. You should be careful. And if it is the low level thing, it's very less in number. You can always ask your storeroom people to just contact the supplier. Maybe within 1 or 2 hours they can just give it. It depends on the supplier. So this sort of simulations, if it is there before the training or before they get into the job, be really good. That's what we do. So in the next video, there will be a racing game where exactly the same thing we are going to simulate, where there will be a aggressive overtake and unconventional overtake we are trying to pull out the innovative brain skills. And there will be a nursing simulation which is already there. So I myself will be playing the nursing game even though I'm not a nurse, and let's see how I can tackle the nursing situation. So thanks for watching this long video, and stay tuned and please subscribe and have a good day.